You have to know your disease better than your doctor. Like, why does the patient need to know that? Because I knew a lot. But what I realized over time was most people don't have access to like a specialist like myself. And we do need to know more than our physicians to challenge them, because it's easier to get patients to drive a change in the way we're treating than to like get doctors to change the way that they're treating patients.
It's frustrating, but it's true. It's very hard to move the slow moving ship that is the healthcare system. Welcome back, everyone, to the Integrative Women's Health Podcast. I'm here with Dr. Kerin Orbuch. She has been one of the leading endometriosis surgeons for the entire time that I've been doing this work, at least 15, 20 years now. And so, Dr. Iris, welcome. And I can't wait to hear how you got into this, because we all know that endometriosis is not well covered in gynecology training programs. Now it's better because of the work you and Shannon Cohn have done, but there's still a long ways to go. So where did this interest come from?
So my passion for the actual surgery was when I was a resident. And well, actually, I think what predated it was I'm a pretty big athlete. So the hand-eye coordination of the sports that I loved, playing video games, also hand-eye coordination, those were just like things that I absolutely loved to do, like Super Mario Brothers, Saving the Princess as a kid. And then when I was an OBGYN resident and I walked into the operating room where laparoscopic surgery was being done, which is largely hand-eye coordination, and I saw this population of patients who were really suffering and no one was there to help them. And I literally fell in love with minimally invasive surgery, and then was fortunate enough to be trained by, I think, probably the two best surgeons in the world, Harry Rich, and Dr. C.Y. Liu. And their passion, they were both at the end of their careers. They were very much like, they were so influential in my career from a surgical standpoint. And then a little bit about me. I am a very critical thinker, a very outside the box human. Like, I put me in a box and I will find a way to get out. So I don't, from the first grand rounds that I gave when I was actually invited back to where I did my residency at Lenox Hill, when I completed my fellowship, I was reading all the literature on endometriosis. And there was one line in one paper by David Redwine, who also is a mentor. He passed away like about a year ago. And it said something like, maybe there's another cause for pain. It was something like that in a conclusion or a discussion. And it stuck with me. So that must have been 2004, 5, something like that. And as my practice was more and more focused on endometriosis, I saw these recurrent descriptions of patients' pain. And I started to really think outside the box, start collaborating with pelvic floor physical therapists and nutritionists like yourself, and acupuncturists, and then neurologists, and then psychologists. And this, like, the scope just got bigger and bigger. And you have to remember, I'm part of a surgical subspecialty. Yeah. So the world didn't want to hear what I had to say. They
Absolutely
really
not.
thought endometriosis is purely a surgical disease. And I still do believe that the cornerstone of treatment for endo is surgical excision of endo. And we need a multidisciplinary approach to fix those, because it's such a systemic, chronic inflammatory disease and disorder. And the symptom onset to diagnosis is roughly a decade. So to answer your question, it's been part like who I am as a human, and part the passion, and part like a commitment, and part just trying to understand this disease to help so many who are suffering.
And so essentially it was an application of your hand-eye coordination, sports, video games skill set to do minimally invasive surgery. And then endometriosis became such an interest because it's really such a challenging disease syndrome for people to overcome. And I, essentially found the same thing, that like in pelvic physical therapy, we could get so far until we hit this wall because the situation is so complicated. So now we both understand that this is an immune, autoinflammatory kind of disease that's driven by nervous system and digestive function and gut microbiome. So as a surgeon, as you just said, that was a wildly new perspective. So how do you actually do that? Like, how do you start those conversations in your office when people coming to you, when they come to me, they expect some kind of integrative stuff. But when they come to you, they're really thinking, okay, I'm just going to have this disease surgically excised and then things will be all better. How do you approach those conversations, and how have you started to sway your colleagues? Because many of them have been swayed in the last few years.
Yeah. So you have to understand, at that time I was practicing in Soho in Manhattan, and most patients were hoping I was going to cure their decade or 2 decade long debilitating symptoms over their lunch break. So this was a very difficult conversation and a very upregulated, hence my move to California, because California is just so much calmer, more parasympathetic driven than upregulated in Manhattan. So, and I love Manhattan, and I love my patients, whether they come from the East Coast or the West Coast. But it was a really hard conversation, and I just have always been driven by this principle, like to really challenge my patients and to challenge the status quo. So it was not easy. Like, I fought against surgical organizations who didn't want to hear about pain, like the multidisciplinary. They didn't want to hear anything about nutrition, gut, mindfulness, pelvic floor PT. I remember even, like, when was it? I was heading one of the postgraduate courses at one of our big meetings. And I remember I fought to bring a physiatrist as one of my faculty. Like, I fought, and I got a pelvic floor PT as well as one of my faculty at a surgical organization. By the time I finished that postgraduate course, I felt like I lost a year of my life. But it was such a pivotal thing to make that happen. And I feel like that exhaustion, it took me about 10, 15 years of like literally going, I felt like a salmon swimming upstream. But I knew it was right, because I was starting to see outcomes that no one else was seeing as I was incorporating all of this stuff. And I think what happened over time, people really started to trust me, and they saw that I was, really in their corner, and they were hopeless, and they're like, okay, I'll try it. And then as they started to feel better, then there was more of a trust. And then, the biggest collaboration came by non-physicians, like physical therapists, nutritionists, psychologists, acupuncturists, and then some out of the box urologists, out of the box, like physiatrists. Like, that's where the true healing, when there was this collaboration. So it was a really tough, difficult thing. And I did it because I knew it was right. Like, I had this knowing, and I have this like intuitive power for healing, both myself, my family, and my patients.
Yeah. There's so many parallels in our experiences of like going from a very kind of Western Ivy League kind of training, to, as you said, like, this is the answer. This is the answer. All we have to do is cut out these lesions. The better we do that, this is the answer. And then kind of fighting with these organizations about, no, the answer is a lot more nuanced and complicated, and it's different in every patient. And we have to kind of bring in these teams. It's the same kind of thing that I encountered, but I agree with you that about 15 years ago, there was I think a group of people from all different disciplines who started to realize, yes, this is how this is. We're not going to have like a one quick fix. It's not just a diet. It's not just a surgery. It's not just a pelvic PT intervention. It's not just mental health support. it's all of these things. So I want to ask you two things, but I think I'll start with this. So later you experienced your own diagnosis of endometriosis when you were in your perimenopausal mid to late 40s. I think one of the interesting things that I'm seeing in my practice now is that I'm seeing more new onset, if you will, endometriosis in perimenopause. And my theory is that some people really are like, that's when their endometriosis is triggered sometime because of perimenopause. But I think for most, it's actually just that the diagnosis was missed for 20, 25 years. What are you seeing and what was your experience?
So it's so funny because the healer has to heal herself. So I actually had symptoms after the birth of thankfully I had two daughters spontaneously. And I started experiencing symptoms after my second daughter was born. So I actually had debilitating pain for 16 years while I was healing others. So that's sort of and people come to me for their expert opinion, but the person who I went to told me, totally gaslit my pain, totally told me, no, you're manifesting your patient's pain. No, you don't have pain. Boy, I'd love to share who that is, but I will never reveal who that is. And that's why maybe I understand my patients so much, because I believe this external figure who was telling me that no, I don't have pain. So, and no, I don't have pain, and no, I don't have endometriosis. So that led me to start healing myself through all these different disciplines. So I had been recommending pelvic floor PT for years at that point. And I got to a breaking point of debilitating pain, meaning I'm doing tons of surgeries a week. I'm helping so many people. And I'm like, where am I going to get help? And I landed in, Beyond Basics, Amy Stein's office. One day I called her. I'm like, I don't know what's going on with me. That began my pelvic floor PT journey, then my gut journey, then my, every single one of these things. And then I finally listened to myself, and the knowing. What happened actually is my older daughter, and she's written about this extensively, when she was 9, she started having debilitating GI symptoms. And again, none of the doctors believed her. And I'm like, she's got endo. My specialty is teens with endo. She has endo. That same person who told me that I don't have endo told me she doesn't have endo. This time, like, a mother's intuition is very different. And I'm like, I know my knowing. She has endo. So, I started all those things, other disciplines, and eventually, as a teen, she had excision surgery, and it was a game changer for her. But it wasn't only the excision of endo, it was the integrative nutrition, it was the pelvic floor PT, it was the somatic work, mind body, which is the same thing that I utilize, same thing I recommend to my patients, because when you have pain for years, it's like the endo that starts it, but then there's all these downstream things that we need to undo. And my daughter has written this great article. She calls endo this invisible foe. And even though I had said to her, I know you have endo, I know you have endo, I know you have endo, we flew in the midst of COVID to have her surgery by an amazing excisionist. And I knew my knowing. And it wasn't until she got to the recovery room where the surgeon told her, yeah, you had endo, that she kind of believed it. And then once she was diagnosed, knowing the incidence, if the daughter has it, the mom probably has a 70 to 100% likelihood. That's then what I then said to the surgeon, I'll be back.
Yeah. Well, and that's an important point, because you and I both work with a lot of young women in their teens, 20s, 30s. And then I also later see their mothers, because it's like, oh, well, I didn't have infertility. I didn't have, some of these other things. So it couldn't have been endo. But then as soon as their daughter has that confirmation, the mother is like, oh yeah, I was, and the fact that you were so powerfully gaslit shows how ingrained that is into our entire system, because it was your training, it was your mentors, it was your colleagues, it was your own mind to even be able to believe that, given your own the soup that we all live in. And I think that's so helpful for people to hear because they're not crazy.
Mm-mm.
They really aren't.
And that's why I share my story to help other people. Like, and I understand them. And I am so like, my heart hurts as I am hearing, them saying, my doctor told me to have a glass of wine before sex. My doctor told me this. My doctor told me I couldn't be endo. I'm too young. Like all of these myths. And then the denial. And then the patients, when I validate them in the office, I'm like, based on my exam, I can tell with 90% likelihood whether a patient has endo. And when I, push on certain things and I'm feeling the endo, they don't, it's like, it's only that awareness where then they start tearing, crying that they almost still don't even believe it, even though I'm telling them. And and the biggest question, just to lastly to say, is I'm doing my pre-ops for my patients. The question I get the most is, what if you don't find endo? And
Mm.
I'm like, that's the question everyone asks me. And I tell them I wouldn't be taking you to the OR if I didn't think that you didn't have endo. And I'm like, I really think there's a 90% likelihood that you have endo. And it's just like this, it's such an uphill battle. And like my heart really goes out to all those who are suffering.
Yeah. Now, I think it's important to just mention every once in a while, someone doesn't have endo.
Mhm.
But I still think everything we're talking about today, addressing the gut, addressing the pelvic floor through PT, even looking surgically for something else, which it could be, the immune function, which can show up as something physical, like adhesion, can show up as like the structural
Mhm.
challenges, whether it's adhesion or something else. I think even if someone doesn't have a diagnosis of endometriosis, if they have discomfort, and in most cases it's significant pain, digestive issues, all fatigue, menstrual health challenges, all of these symptoms, we now know there's this whole suite of things we can do, including mind body medicine, which doesn't mean that it was like in your head.
Mhm.
It just means you didn't have that particular lesion. So maybe that will help take the pressure off a little bit.
Yeah, and anyways, before I take someone to the OR, I'm down regulating mind, body, gut, all of that stuff. And they typically are benefiting from all of those things. And then typically in that less than 10% where I'm not finding endo, I'm usually finding something else
Yeah.
in the surgery that is the answer to their pain. And they've already benefited from all of that prehab that I've done.
Yeah, absolutely. So, one of your specialties, which I think is so important because these are some of the people that get gaslit the most, are tween girls, girls in their young 20s who are in college. Tell me how you might approach that differently a little bit, compared to, say, a woman you're meeting in
Mhm.
her 30s.
Well, I think because I have two daughters, I have an 18 and a 21-year-old. I think my kids' friends think of me as the cool mom. Like I know how to interact with teens. I'm very young at heart. I'm like a kid myself in terms of just my interests and my joie de vivre. And I think just meeting them at their level and whatever their level may be, and meeting them at what they're willing to do, and taking it as slow or quickly as they feel that they're ready to go. I think also there's something about safety that the teens feel with me. It's like, I'm like, I got you. Like, I'm here with you on this journey and I'm never going to give up on you. And like, whatever that may be, it may be slower, quicker, whatever it is, it may be starting one thing at a time very slowly. I'm not like, this is how it's got to be. You got to do it my way. I'm resisting how they want to do it. I'm meeting them where they're at and then figuring out how to apply things within their, the way that they live their lives.
Yeah, absolutely. So, if you think about kind of endometriosis, the state of where we are in terms of awareness of this disease, helping women who are struggling with it, think they might be struggling with it, want their practitioners to take them more seriously, their families. What are some suggestions you have for either individuals potentially living with this or practitioners who are taking care of them in terms of what we really know that you don't think we're addressing enough in the day-to-day? Because I think, unfortunately, still in most places, it's up to the patient to educate the provider.
Correct. And that's why I wrote my book,
Mm-hmm.
Beating Endo, How to Reclaim Your Life from Endometriosis. So it is a guidebook for a patient, whether, wherever in the world they are, if they're living in a rural village or a major metropolitan city, they are taking this guidebook of my book to their gynecologist and saying, can you write me a prescription for pelvic floor PT? This book shows the correlation. Here's the studies, blah, blah, blah. Taking it to the GI. Can you, test me for small intestinal bacterial overgrowth? Or taking it to the integrate or to the nutritionist, who's a mainstream nutritionist, saying,
Mm-hmm.
can you look at my large intestinal health or whatever it is? So I wrote, there was one line in the first movie that Shannon Cohn made, which was Endo What? I think that premiered in 2015. And we had worked on it, I don't even know, 10 years, 8 years before it came out. I don't even remember. That was a whole uphill battle for that movie to come out. I mean, it was crazy.
Yeah.
And that was the beginning of this train that was very slow moving to move. And there's one line in that movie by Mary Lou Balawag, who is the head of the Endometriosis Association, which is founded in Milwaukee. That was one of the first endo organizations. And she really looks at endo as an immune dysfunction. She was looking at it really early on, before anyone was at that time. Mary Lou and I became very close when I was a resident. And her pearls of wisdom, I think, also sparked my And there's a line that says, you have to know your disease better than your doctor. And when I first was reviewing all the cuts of the movie, I didn't understand that. Why does the patient need to know that more than their doctor? Because I knew a lot, but what I realized over time was most people don't have access to a specialist like myself. And we do need to know more than our physicians to challenge them. And so, the book was written as a guidebook to help challenge doctors, because it's easier to get patients to drive a change in the way we're treating than to treat doctors to get doctors to change the way that they're treating patients. So the decision really was let's empower the patients to help themselves, because that's going to be the best way to affect change.
Yeah, it's frustrating, but it's true. It's very hard to move the slow moving ship that is the healthcare system and all the different kind of distinct parts of it. So let's circle back a bit to having your diagnosis in perimenopause. So you're also probably navigating perimenopause at the same time that you're thinking about surgery. So for women who are listening to this, or their practitioners who are working with women in their 40s and 50s, who either never had their endometriosis addressed, or maybe the hormone shifts of the time, or even just getting sick in perimenopause. One of the things I'm seeing now that we're in a COVID environment where everyone's had this new immune dysregulator. And, when we now know more about Lyme and MS being triggered by herpes viruses and things like that. So this kind of relatively more pathogen toxic and also environmental toxic soup that we're living in. I think there are some people who just didn't get the trigger until they were in their perimenopausal years. So how would you think of that now? What are some of the things those women should be thinking about a little differently than if they're in their 30s?
So I think I love that you're bringing up just the whole viral, bacterial, Lyme, all autoimmune diseases. Yesterday, I think just about every one of my patients I saw in their office, not to get off track, but has a new diagnosis of POTS. They have a new diagnosis maybe of mast cell activation. They are being band-aided by their primary care doctors, and no one is putting together this whole, what's the etiology of all of this? So that could be a whole nother discussion that I'm so interested in, and I can't stop reading about all of this. But I think, for me, I wasn't even perimenopausal yet, even though I
Mm.
was like around that age. But it's tough to know, is it because all the hormones are affected by all of these things, whether testosterone starts to decrease, all the hormones get thrown off because everything's being thrown off from the brain and the hypothalamus and the pituitary. I don't know, is that the trigger in combination with the natural shifts and the decrease in our own hormones? Which one's the onset, which one? I don't know. But yes, there are. It's hard to know because my patient population tends to skew much younger than the
Hmm.
perimenopausal age. And that could be because I specialize in teens and 20s. I mean, though I see all endometriosis patients, there's more social media out there for earlier diagnosis. So I haven't seen like that mid 40s to early 50s spike in my practice. That was the age group I used to see 10 years ago for
Mm.
consult. So it's hard for me to tell. I totally agree with what you're saying. I just don't see that so much in my office.
Well, and I think what you're saying is so important. The good news that we've had in the last 15 years with Endo What, with the onset of kind of conversations like this on social media, is that women who are in their teens and 20s, women and girls in their teens and 20s, are recognizing that they might have endometriosis and then pushing that change to their primary care doctors, to their gynecologists. So we are, I mean, there certainly are communities that are lagging. There are communities that we need to further address, but the diagnosis and just the word, the disease state of endometriosis is more readily understood. So we are getting some earlier, better
Mhm.
treatment, which is good. I really do think that from my perspective, because of course I see all the people that are very challenged with these huge buckets of
Mhm.
issues, that COVID virus, because we know it lives in reservoirs for at least a year, maybe two, based on the data we have, and then maybe forever, simply like, similar to Epstein-Barr and other pathogens, could be driving some of the autoimmune related issues of endometriosis in combination with any of those other pathogens. And especially when you think about POTS and MCAS, this sort of new, we used to call it the terrible triplets of endometriosis, bladder pain, and vulvodynia. I think there's sort of a new terrible triplets that maybe was always happening and we weren't looking for it as much, but definitely because you and I were talking about histamine probably 8 years ago at the Endo Summit, but it's new for again through social media, which I think is a good thing for people to be recognizing when they have POTS or some kind of dysautonomia, MCAS. So the new terrible triplets of endo, MCAS, and dysautonomia and hypermobility
Yeah.
seems to be what I'm seeing all the time. And I don't know if we just weren't looking at it before or because of the new pathogen environment, it's happening more often.
I think the latter. I really do.
Mm.
I think it was there and I was seeing it, but not as often. And I was picking up on it on my patients who had multiple autoimmune issues. They were reporting these hives, they were reporting all of these things. So I saw it happening in my patient population. But it was, I think, COVID just being so prevalent is what accentuated it. I actually heard such a fascinating podcast about 2 weeks ago by this long COVID specialist who was, I think, at Kaiser and then maybe UCLA. I'll send it to you. And
Hmm.
she is finding help in helping her long haul COVID patients with pain reprocessing.
Mm. Yeah.
So fascinating. So I'm really delving into that to learn more about it, to see what I can do to help my patients because there's such an overlap. Yeah.
Yeah, because I think both, as you were just mentioning, start in the brain, right?
Mhm.
So, or maybe are driven at least to the brain at some level. So, when you can help regulate vagus nerve and
Mhm.
autonomic nervous system, I think that's the key to
Yeah.
the rest of it. Then, of course, we still have to get rid of the viral persistence and we still have to regulate the immune system. But it's almost like you can't do those things and have them stick
Uh-huh.
until the nervous system is more regulated. So, to wrap up this conversation, when we think about nervous system regulation, you've for years emphasized this for your clients pre surgery, and obviously that makes it easier post surgery. What are some of the best recommendations you have for clients who are preparing for surgery when it comes to healthfully regulating their nervous systems?
Yeah. So when I meet my patients on initial consult, one of the first things I have them do after I explain endo, I explain this multidisciplinary approach, I give them a meditation challenge. And
Mm.
I give them the data that, because I explain how pain, like there's a part of it is the way the brain is processing pain. Part of it is true organic pain, and that's a whole long discussion. But I give them a meditation challenge, and I tell them that the data is around. If you meditate the same time every day for 6 weeks, there's great data to show that there begins to be a rewiring of the brain, and doing meditation is free. It's
Right.
free to meditate. So something that you can do at home. It's portable. It's cheap. And so I get them meditating from the beginning. I try and get them to sleep at reasonable hours. Try and get them to eat more of like an autoimmune, healthier, I get them in with an integrative nutritionist. I definitely think working with a pelvic floor PT who understands breath work, mind, body, helping patients have an awareness within their body, because most of my patients are actually outside of their bodies, like to escape
Mm.
pain in so many ways, to kind of bring them back into an embodied state. I think educating them to understand their pain. And the one thing is, healing from surgery doesn't take 2 days or 3 days like most surgeons tell them. It doesn't take a week and you're back at work. You'll be right there. Like, I let my patients know that whether you fall and skin your knee on a bike or you have surgery, the physiology of healing is the same. It takes 6 weeks for 60% of the healing to be completed and 3 months for full healing. But it doesn't mean that you're going to be better in 6 weeks or 3 months. It's how many pain generators do you have? How many are converging? It's very individualized, but I give themselves time to heal.
Yeah. And having some of those tools at their disposal, like just consistent, a few minutes of meditation
Mhm.
every day is a really good way to do it because, as you said, it's accessible to everyone. Yeah, I love that.
Mhm.
So, what's next for you, and how can people reach out and learn more about your work and come see you as a patient?
Yeah. Well, I'll start with where they can find me.
Mhm.
So I'm in California, in Los Angeles. I do virtual consults all over the world as well as in person. They can find me on Instagram, which is DRIRISORBUCH, Dr. Iris Orbuch. Or my website is lagyndr.com, lagyndoctor.com. Call my office. I would love to see you as a patient. I have a lot of exciting stuff coming down the pipeline that I can't share just yet,
Okay.
but I have so many things that I'm working on and excited to announce in time. Yeah.
That's fantastic. I'm excited to see it.
Yeah.
So go follow Dr. Iris Kerin Orbuch on Instagram and at your website. And we'll also include links with the show notes for your book because I do think every person with endometriosis should carry that to all their doctor's appointments, especially if they're feeling gaslit by anyone.
Mhm.
And know that your deep knowing is really what saves your and your kids' health.
Mhm.
And so if people are questioning their deep knowing, you can trust it.
Mhm.
That's really where it all begins. So
Mhm.
thank you so much.
Yes, thank you for having me. I so appreciate just the conversation.
Yes, always. Thank you, everyone, for being here with us. And I'll see you next week on the Integrative Women's Health Podcast.